Cranial Nerve 1, olfactory. Instruct client to close eyes, test one nostrils at a time with the opposite side occluded using three materials such as soap, coffee, and toothpaste.
Okay, Miss, please close your eyes. Can you smell this thing for me?
Coffee.
Okay, next thing is
A toothpaste.
next thing is
Soap.
okay. You can open.
Cranial Nerve 2, which is also known as optic. Assess visual fields by confrontation test. Use Snellen chart or newspaper to measure visual acuity.
Na ano ka line? A.
Line A.
Sige.
D, E, F, P, O, P, C.
Next, cranial nerve 3, which is oculomotor. First, we will be looking for any involuntary shaking of the eye called nystagmus. In order to do that, we're gonna take over pen light and hold it about 12 to 14 inches away from the patient nose. And then let your patient head still and don't let him move his head and just his eyes to watch where I move the pen light. Perform it in the 6 cardinal fields of gaze and you're just going to move it. You're looking for any involuntary shaking of the eyes. Next is we're gonna see how reactive the pupils are. We're going to dim the lights a little bit and let the patient stare off at a distant object that helps dilate pupils. And then we're going to shine using our pen light. And at the side, and we're gonna see how the pupils response. Is she constrict, and on the other side, it should be constrict as well. The baseline of the pupil size was like 3 millimeters, and it should go down to 1 millimeters, and it should have. Next, we're going to check the accommodation. Turn the lights back on. Let the patient to stare off at a distant object that has dilate the pupils. Take the pen light, slowly move it inwards to the nose, and what we're looking for is that those pupils constrict and they accommodate and the eyes cross while looking for the pen light. Instruct the patient to stare off the distant. Don't move, just keep it still and just follow the step of the pen light.
Next is the cranial nerve 5. This nerve is responsible for many things like massification. First, let the patient clench her teeth. Please clench her teeth. Nang bite down. Please bite down. And I'm going to feel the masseter muscle, which is the right here. There should be nice and firm ball. Then feel the temporal muscle. Next is let her try to open his mouth against my resistance. Open your mouth. Okay. The cranial nerve 7, which is the facial nerve check. Look at the facial expression and test cranial nerve. Let the patient close his eyes tightly and open them up. Close your eyes tightly and open them up. Next is let the patient smile, frown, and puff up your cheeks. Good. The patient did that with an E, and the cranial nerve is intact. Next is the cranial nerve 8, the vestibulocochlear. I'll be covering one of her ears and whisper 2 words on the other side. The patient should tell me what I said.
Apple, banana. Apple, banana.
Okay. And the nerve is intact. Next is the cranial number 9, the glossopharyngeal. Let the patient open her mouth and say ah. Please open your mouth and say ah. Next is to uvula to move up. Test the gag reflex. Poke a little bit back and then elicit a gag reflex. And The vagus intact because he was able to talk. That's it. Next is the cranial nerve 11, the accessory nerve. Let the patient move side to side and up and down. Try to shrug against the resistance, and when he does that with an ease so that the nerve is in intact. Is the cranial nerve 12, the hypoglossal nerve. Let the patient stick out his tongue or her tongue and move it side to side. If he does that with an ease, please stick out your tongue and then side to side. And she did that with an ease, and the nerve is intact.